All right, ladies and gentlemen, welcome to the Medicare 101 webinar. My name is Kevin Chaikin. I'll be your host here today, and we'll jump into the content here in just a moment. We've got hundreds of people still funneling in, about 2,000 or more that were registered for today. So we're not going to wait for everyone, obviously, to come in, but people are still funneling in here one by one. So a couple housekeeping items while we have a moment. Number one is I would recommend grabbing a paper and a piece of paper and a pen. Take some notes. We are certainly going to go over a lot of information here, and we have plenty of information we can send you. But there are certain things you may want to write down, so we do recommend that. So go ahead and grab a pen and paper. Number two is our book here. So I wrote this book, Medicare Breakdown. Oops, excuse me. I'm already moving forward here. So Medicare Breakdown, Alphabet Soup of Medicare. So this is a helpful guide. You all should have a copy of this. So if you did not receive one when you registered, please let us know. You can text or email back on the webinar confirmation, text or email, and then let us know if you didn't get the PDF, and we'll send you a digital copy of Medicare Breakdown. Just one of many resources that we have available to help folks out as you're going through your Medicare journey. Finally, we just want to let you know there's a calendar. You should see that on the page. There's a calendar where you can book a time with our team one-on-one at your convenience. And some of you may not be able to make it through the entire webinar. Totally get it. Life happens. We're all busy. So if that happens, or you do make it to the end and you're ready to get your questions answered and talk to our team, go ahead and click on that calendar. Spots do fill up quickly, as we already see some people actually that are booking times right now. So we do recommend, if this is something you want to discuss and get some professional help and some questions answered, go ahead and book a time anytime during the webinar. You can book the appointment and keep watching, or you can wait till the end, whatever it is that works best for you. So without further ado, since we have now over 1,000 people online with us here today, we are going to go ahead and jump right in to the webinar that you came for. So again, I'm Kevin Chaikin, and this is the Medicare 101. So this is going to be brief about me and the organization. We are going to get right into the content. But this is important to me. And this is why I get up every day and why I'm not going anywhere in this business. I do this every day for my family, my daughter, my two sons, my wife, even my parents and my in-laws have done so much for us, right? So family is what it's all about for me. I'm a proud husband and father. And I do feel committed to the mission of giving back to my parents' generation, okay, which are Medicare beneficiaries, by providing guidance. That's my purpose, and what drives me to continue doing this every day and for years to come. We're not going anywhere. It's because I've got these people right here who mean so much to me that wake up to support every day. So I'm the founder and owner of Insurance Masterminds Agency. We are a partner agency of MP Group. So you'll see, maybe not here, but Insurance Masterminds of MP Group. And we're Medicare retirement experts. Okay, this is what we focus on every day. I'm not going to pretend to know about home and auto insurance or 401ks and retirement planning. Okay, we are Medicare and retirement experts. I am an author of Medicare Breakdown. That copy of that book is yours. Just send us a message if you did not get it when you registered. And look, I coach agents every day, and we coach and teach Medicare beneficiaries every day. Usually over 50,000 a year through these webinars. That we're constantly providing education on Medicare to, and that leads us to the next slide here, where we're an education platform. All right? At the end of the day, this is not a webinar that you are going to be sold one type of Medicare product on or a specific company. This is all about educating you so that when it comes time for you to start making decisions and taking action, you are empowered to do so, whether that be working through us when you set an appointment, or you go to another broker that's a better fit for you, or you do it yourself even, okay? But education first. We've got several thousand clients. We just started, requesting these reviews recently, so only at 75, at least as of today, but that's ever growing, and we're 5-star rated. We do tons of digital learning, as I mentioned, to over 50,000 beneficiaries every year through these webinars, and in person to several thousand others in our local market. And should you want to follow us and find more content, maybe shorter bite-sized clips on TikTok, Instagram, Facebook, etc., feel free to scan this QR code. If you don't get around to it while you're on the webinar here today, don't worry about it. Just, again, text or email. We'll send you a link to follow. So this is why we're here. Let's dive right in. Original Medicare. So original Medicare consists of parts A and B, Alpha and Bravo. And part A is your hospital coverage on your Medicare card. That's what it'll say, hospital part A. This is more inpatient, okay? And most of you will pay zero per month. Your taxes have actually paid the premium on this. So if you qualify for Social Security retirement benefits, you also qualify for premium-free part A. Medicare Part B, that's your doctor coverage or medical, as it says on your Medicare card. And this is more for your outpatient coverage, your day-to-day use. And that does come with a premium. The vast majority of Americans this year in 2025 are paying $185 per month. If you are considered a higher income earner, you may pay more. We'll help you to determine exactly what you'll pay when we chat with you one-on-one and how to appeal that, by the way, and not overpay for premium. Or you could be on the other side of that and have some of this subsidized if you're on something like Medicaid. So most of them will pay $185, some more and some less, depending on your situation, which we'll learn here today. Everyone's situation is different. There's no one size fits all when it comes to Medicare. And in the same vein, let's start with the three scenarios of enrolling in Medicare. Okay, so number one, you're currently receiving Social Security benefits. Scenario two, you're not receiving Social Security benefits, but that should say, and you're retired or not working. And then scenario three, you're still working and covered by an employer plan. Okay. All right, so original Medicare scenario one, you're currently receiving Social Security benefits. If that's the case, you're receiving those before turning 65, then you will be automatically enrolled in Medicare. About 3 months prior to your start date, you will receive a Medicare card in the mail, red, white, and blue card with parts A and B. And assuming at that time you're taking Medicare, which most will who are on Social Security, you've got one thing checked off your list since that automatic enrollment occurs. And that month that Medicare begins, you'll start to have that $185 or whatever your premium is at the time will be deducted from your Social Security check. If for some reason you don't want Part B, and we'll figure out why that may be in our one-on-one conversation with you, but you can refuse it, but it takes another step. Scenario number two, okay, if you currently do not receive Social Security benefits, then you have to manually enroll. So you are turning 65 and you're maybe still working or not, but you're not getting Social Security. Nothing will happen automatically in this case. You're not going to be notified. So you would actually go online, would be our recommended approach. You're here today on a webinar, so you're probably savvy enough to go online and apply. That is the easiest, most effective way to do it. We also have a nice, helpful video. We'll help you do that in 10 minutes or less if you reach out. Happy to send that over to you because that's the gold standard way. Now, you can do it over the phone. You can do it in person if you can get someone on the phone or you can get an appointment. All Social Security offices are a little bit different in terms of walk-in traffic and appointments. Those are options. You could also mail in an application. If you're not, of course, if you're in this scenario, you're not taking Social Security, then Part B will actually be billed to you quarterly. So now instead of paying $185 a month, you're getting a bill in the mail every 3 months paying $555, which is 3 times $185. And that's how you would pay. Again, not everything has to be so manual. You can sign up for automatic monthly payments on Medicare Part B before Social Security starts. And we have a nice helpful video on how to do that to set up Medicare Easy Pay within a couple of minutes. So you're just paying it automatically every month. Now, scenario three, if you're still working covered by an employer plan, you're either going to enroll in Medicare effective on your 65th birthday or you're going to delay Part B. In many cases, you're still working, you can delay Part B with employer coverage. That includes a spouse, okay? If you are you're covered by your spouse's employer plan, but you're eligible for Medicare, you can typically continue on. Sometimes you should keep your employer coverage. Sometimes you should go on Medicare. Sometimes you have to do Medicare. That's really dependent on employer size and certain things. So again, we'll help you figure that out one-on-one. Don't assume that you're automatically going to have to apply for Medicare Part B and you go do that today if you still have employer coverage, because you might not have to. Okay, not everyone has to do that. A lot of people can delay coverage and avoid late enrollment penalties. So Medicare enrollment coverage begins the first day of your birth month. You actually can enroll 3 months prior. So I'm an April baby. So for me, when Medicare comes around, if it's still there, I'll be starting Medicare on April 1st, and then I'll be able to start enrollment on January 1st. The exception to that rule is if I'm born on the first of the month. If I was born on April 1st, my Medicare would actually start March 1st, and my enrollment period will all move up a month. I'd start December 1st. I'd be able to enroll with Medicare beginning on March 1st. So coverage begins the first day of your birth month unless you're born on the 1st. Now, why we're here today is not only learn about these enrollment periods and everything, but what are you in for when it comes to cost and coverage and financial risk. At the end of the day, there's no perfect insurance, and our job and our goal is to make sure, like I said earlier, that you are retiring with peace of mind. You're not facing medical bankruptcy, so you are protecting those assets that you built for retirement. Now, exposures under Part A. There's a deductible of $1,676 per benefit period. So this can happen multiple times in a year. There are additional copays not listed here, but they are upwards of over $400 or even $800, depending on how many days you're in the hospital once you get over 60 days. So pretty hefty. Part B, you have a very small deductible. That's not what we're too worried about, right? $257 is the Part B deductible for the year, which is pretty minimal, and that is annual, not per occurrence. But 20% coinsurance on all Part B services, not only a doctor's visit, but a surgery, chemotherapy, radiation, durable medical equipment, right? All these different things, you're paying 20%, and there's no max out of pocket on either parts of these. So the deductibles, copays, and coinsurance just keep going with no limit. There's also something called Part B excess, which is a 15% excess charge above what Medicare allows that Part B could expose you to. Again, we're talking about today how to avoid all these exposures. So don't worry about it. We're going to get you there and make sure that you have everything that you need. Now, this is Medicare's big decision. In my opinion, if you're writing anything down, write this down. If you're not paying attention, pay attention now, because this decision will have a long-lasting impact on you. And it is the big decision, in my opinion, when it comes to Medicare. So I didn't make this image, but my team that put it together actually worked out perfectly, because I do liken this decision as walking down a road. So you're going down a road and you reach a fork. All right, there is no path forward without going left or right. And so we have options. You got to choose one. Now, you're either going to stick with original Medicare, you have A and B as your primary payer, and you add a supplement. Medicare supplement and Medigap, by the way, are synonymous terms. So in case you hear both of those, that's the same thing. And you can also add Medicare Part D as a standalone, which is a prescription drug benefit. The other option is you go the other direction on this fork in the road, and you take Medicare Advantage or Medicare Part C, which combines your coverage. Now, I like to think of the C as standing for combined. Didn't come up with the fact that it's Medicare Part C, but in my head, that's what makes sense. So C combines coverage, combines A and B, prescription coverage, and potentially some other benefits that we'll get into here in a little bit, because that Part D plan we usually wrapped up. So it's one card usually over here versus these two different policies with supplement and prescription coverage on the first road. So comparing these two options, let's just talk about it. Medicare supplement, this is going to be more of your fixed cost predictable option. I like to call it peace of mind, quite frankly. So you're going to pay your Part B premium, and we'll assume, again, since the majority pay $185, that's what you're paying for Part B, plus your supplement plan. Now, we will provide some pricing here in a little bit, at least some general range of pricing on supplements, but it's based on a lot of factors, right, variables. So you will pay whatever that supplement premium is on top of Part B. You have to have A and B for the supplement plan to work. This is going to provide you the lowest out-of-pocket cost for Medicare covered and Medicare approved services. You go to the doctor, hospital, these are things that are covered by Medicare and Medicare approves them. The supplement provides you the lowest, most predictable out-of-pocket cost. Networks. You can choose any doctor anywhere in America that takes Medicare. There are no networks. There are no referrals required. So regardless of the company that's providing this Medicare supplement, if the doctor takes Medicare, they will take your insurance. So you're asking if they take original Medicare, not the insurance company with your supplement. And again, Part D is a separate policy, separate cost. You're going to pay a premium for that plan, and that's going to be a completely separate policy provided by a prescription drug company. So a little bit more expensive on this side with lower, more predictable out-of-pocket costs and more provider flexibility. although you also have multiple cards and policies that you're using. Option 2, Medicare Advantage. Okay, this is going to be your more lower fixed cost, higher variable, or more variable and higher potential cost. You have to still pay Part B. They can't stand the ads and the people that call about, don't have to pay for your Part B premium. It's $0. There are $0 policies. Absolutely. We're going to talk about that. That is legitimate. But that does not mean it's $0 replacing your 185. You have to pay that 185. So continue to pay Part B plus whatever your Medicare Advantage premium is, which could be low to no premium, which we'll cover here in a little bit. Your coverage, on your coverage here, you're going to have higher out-of-pocket costs. This is where they are, you have lower fixed costs, but higher potential out-of-pocket costs, more variable. It's all based on your utilization. You pay as you go. You are going to be in a network-based plan. This is nothing like you're not already used to. Your employer plan, your marketplace plan through ACA. It's a managed care organization with a network. So same thing goes with Medicare Advantage, HMO or PPO network typically, where you're best served by staying in the network. And Part D and extra benefits are typically included. So this is a more benefit-rich option where you don't typically have to go shop for separate drug coverage, and things that Medicare does not cover, like dental, glasses, hearing aids, can be included in these plans, maybe gym memberships, over-the-counter allowance, all sorts of stuff. So again, just comparing the two side by side. And by the way, told you I wasn't going to use this much. It is a good idea if you want to write something down, is make a T-chart here, all right, and just do Medicare supplement versus Medicare Advantage. You can go boom, 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 boom with each piece, right? Price and coverage and network and everything. So I'll let you do that, but that's a good way to visualize this. It's very similar to what you see up here. So anyway, we recommend doing that. But again, over here, Medicare supplement, higher monthly costs, more provider choice, lower potential out-of-pocket costs, less variability. Over here on Medicare Advantage, lower fixed costs, more variable expense, higher potential out-of-pocket costs. You are dealing with the networks, but you're also getting more benefit included in that plan. Now, we get to one of the first major exposures on Medicare that we're here to talk about today, and we already covered deductibles and whatnot for the hospital. Cancer, heart attack, or stroke coverage. Okay, now we recommend cancer coverage to every Medicare beneficiary, every client that walks through our door, because you will face costs when it comes to a cancer diagnosis on Medicare. Okay, whether that be prescription costs, covered or uncovered prescriptions, whether that be treatment costs, okay, for chemo, radiation, whether it be for non-medical costs like travel, lodging, loss of employment. There could be wigs, cold caps. There's all sorts of things, right? Dietary changes and home modifications that can also, by the way, be impacted through a heart attack or a stroke, right? So there are costs associated with it. So we always recommend one of these critical illness policies to our clients and to all Medicare beneficiaries. Those amounts can vary per diagnosis. The way that you build these plans can vary based on your needs. We'll talk about that with you one-on-one. The second major exposure, and this one is the largest exposure there is on Medicare, no matter whether you go supplement or advantage. And if you're talking to another broker or agency, or you're watching another webinar and they're not talking about skilled nursing recovery exposure, run. It doesn't have to be to us, but find somebody who's talking about this, because this is critical. Again, our goal, and excuse me, I'm grabbing some water. Our goal is to make sure that you are not going broke due to medical costs in retirement. So look, skilled nursing coverage. In each benefit period, days 1 through 20, you pay $0. Now, Medicare, typically, traditional Medicare covers the first 20 days. And so that would, of course, since that's your primary payer with a supplement, you pay $0. Medicare Advantage plans, a lot of them do cover the first 20 days, but not universally. So it depends on your plan. You have to understand, am I subject to any payments the first 20 days or not? Where it really starts to get out of hand is after day 20. So days 21 through 100, $209.50 per day. That is the standard Medicare dollar amount. That's almost $17,000 for a year. Excuse me, for 100 days, because it's 80 days of that. Now, your Medicare Advantage plan may have a higher or lower copay per day. If you're on a supplement, that may be covered partially or fully. Okay, so this is not necessarily your exposure on all plan options, but that's the exposure. The bigger thing is here. After day 100, you're responsible for all costs. So no matter your Medicare A and B, your Medicare supplement, your Medicare Advantage plan, none of them are covering you after day 100 of skilled nursing. Okay, so it's really important to understand that. Now, a couple other things to note: your doctor, your healthcare provider may recommend treatment or care more frequently than what Medicare covers. They may recommend treatment that Medicare just generally doesn't cover at all. So it's important that you ask your doctor, ask your healthcare provider, how the impact of this would be with Medicare coverage, so that you're not caught off guard with any of these things, and ultimately making sure you have the proper coverage when you do need to use these things at the end of the day. Now, this is Medicare New Handbook. You can get this online. Go to CMS or Medicare.gov. You can download this. You can request one to be mailed to you if you haven't received one for this year. Medicare New. What I want to highlight here goes back to skilled nursing. Medicare only covers skilled nursing facility care after a 3-day minimum medically necessary inpatient hospital stay, not including the day of discharge. Okay, so that means you really need to be there for 4 days as an inpatient. And there are times when you may be in the hospital under outpatient observation. That is not a day in the hospital. So when you're admitted as an inpatient, 3 days, not including discharge day. So if you don't have that minimum requirement, you will not be approved to be discharged to a skilled nursing facility and you're going home. Now, maybe you prefer to receive care at home and talk about that on a one-on-one conversation with our team about how to protect yourself and get what you want there. But you don't necessarily always qualify for skilled nursing. If you were reading through this further, you would also read that you have to be maintaining or improving on your condition while in skilled nursing for Medicare to continue to approve and pay for that. So what happens if they determine that you're not improving? Then again, they may discharge you and send you home. This is one of the biggest challenges on whether you're on Medicare, Original, or Advantage, is dealing with the skilled nursing coverage and the approvals, quite frankly, that are necessary to continue getting it. So this is where we talk about covering you through a proper umbrella coverage. Okay, 1, 2, and 3. We mentioned we always talk about cancer coverage for all Medicare beneficiaries, depending on the way that you choose on that fork in the road to go. You might be opting for hospital protection or added dental, vision, and hearing, and then going back to the skilled nursing stay, home recovery care. So just keep this in mind for later. We're going to keep moving on to for the sake of time, but you should end up getting a copy of this as well when you go ahead and schedule your appointment with us to see again what option works best for you between umbrella 1, 2, or 3. So Medicare supplement. Again, let's recap those exposures. $1,676 deductible on Part A, plus copays for days 61 and on. Part B, $257 deductible, 20% coinsurance, and 15% Part B excess. So what do we want to do here? This is how your coverage looks if you were visualizing it. You have red, white, and blue card, original Medicare, Medicare supplement, Plan G, Plan N, whatever it may be, and then your drug coverage, which is a separate standalone plan. So on the supplement, by the way, also called Medigap, I may have mentioned that earlier, this is a private health insurance policy. It's a secondary policy that helps to cover some or most of original Medicare's out-of-pocket costs. So the things that we covered in terms of exposure under A and B, this type of plan is going to cover the majority of that when it meets Medicare standards and it's approved. So this is a very, like I said, peace of mind, low out-of-pocket cost way to get your coverage. These are the plans available. We're not going to go through each one. All you need to know, C and F, no longer available as of January 2020 for new Medicare beneficiaries. G and N are your most popular. Therefore, they are the most competitive rate-wise, so most competitive pricing because they're used so much. They're also the most comprehensive. So it's kind of a win-win because if you go with one of these plans like A, no one uses it anymore. It's not going to cover you well, and minimal enrollment means not very competitive rates. So going back to skilled nursing coverage and the exposure here. The nice thing on a supplement like Plan G or Plan N, you actually don't have to worry about these first 100 days. Okay, days 1 through 20, 0. Days 21 through 100, that $209.50 is paid every day by the Plan G or the Plan N supplement. So we're not worried about those first 20 days as long as you qualify for the skilled nursing, right? You have to meet that minimum requirement of 3 days in the hospital. It's still after day 100, however, that you have nothing with Medicare A, B, or supplement. As great as the supplement is, it even adds days to your hospital, lifetime hospital days. It does not add days to skilled nursing care. So we do want to protect you from that. So the cost of Plan G, and this varies, right? So this is a pretty large range. $100 to $200 is the average cost, but it depends on where you live, your age, your gender, your tobacco usage, household size, the company that you choose. So a lot of things go into that, but that's a good, just if you're writing things down, trying to get your budget, right? 185 for Part B, 1 to 200 for Plan G. And then as we compare G and N, which is the best and what are the cost differences? Well, if Plan G is 100 to 200 a month, Plan N is approximately $20 to $40 per month less. Again, depends on the factors we mentioned earlier: age, location, gender, company, etc. But that's a good general guideline as you're writing down numbers here. On Plan G, for all Medicare approved services, it's a beautiful thing. You will only pay the Part B deductible. So if I turn 65 in April, I start Medicare April 1st, then I pay the first $257. Medicare kicks in on everything under Part B. They pay 80%. Plan G pays 20%. All my hospital copays and deductibles are paid. So for Medicare covered services, Plan G leaves you with a fixed cost model. Just the deductible is what you have to pay. Plan N, a very good plan still, just almost equally as comprehensive. Just a couple things that are variable here. Same deductible, you'll pay the $257. Medicare sets that every year, so that will change every year, but you're always going to pay that on a supplement. And then you will pay up to $20 copays for office visits and up to a $50 copay for an emergency room visit if you're not admitted to the hospital. If you are, you will not pay that $50, but $20 and $50 respectively, so pretty minimal. And there's something called Part B excess, where you would have to pay up to 15% above what Medicare allows. We are not as concerned about that exposure as we are about things like skilled nursing and cancer exposure. Right now, it is something you have to be aware of, but it is highly unusual, unlikely that you'd run into it, but helps you understand why this plan is a little bit cheaper than that plan. So key points about supplements. Best time to enroll is 6 months prior to the start date. Why? Well, number one, you want to lock in the best rate. These rates are likely to go up over time, if not year one, certainly over the years. So lock in your best rate now. If you lock it in now and there's a rate increase between now and the start date, you're going to have today's rate, and that will be from 12 months from the start of your policy. So really 18 months from the time you sign up. It also just helps you avoid mistakes, right? If something's wrong with the application or you forget to sign something, we're on top of it early, and then check it off your list. You're here on this call today, I assume, because you're a planner, you're a researcher, so you're trying to get things checked off your list. Well, that's one way to do it the right way. Again, these plans are standardized. So if you go back to that chart we looked at earlier, like Plan G or N, the benefits are standardized by the plan letter, not the company. So 3 companies offering Plan G, the deductible is the same for all 3 of them. And what you pay after the deductible is the same for all 3 of them. They're just going to vary in things like premium, which is one of the most important things, customer service, premium history, right? What's the rate stability? And then some of these companies may offer some ancillary benefits like a gym membership, but that's, that is where they differ. Here's about almost 20 companies. I think that's about where we're at today with Medicare supplement. I have no allegiance to any of these companies. You will find that we are here to serve you. We work for you, not the insurance company. They're a business partner of ours to help bring you the right solution. So any one of these companies, though, we do business with and have been doing for years, and we'll help you find the right one based on your area and cost and all the things that you need to check off your list. So let's talk about some myths real quick, and we'll keep going, get into Medicare Advantage and everything. So myth number 1, I must have to pay a fee to use a broker and get their help with all this. Seems like a lot of work. Well, as a matter of fact, it is a lot of work, but we don't charge a fee. We actually can't charge a fee, okay? If I'm helping you with your insurance, it's illegal for me to charge you a fee. So you'll never get a bill from us, even when you click on that calendar, by the way, just a reminder, and set that appointment with our team. And spots, I'm just keep watching here. The spots are filling up pretty quickly, so we're getting out 2-3 weeks out now. But once you do that, we're not going to send you a bill. You're not ever going to get a bill for our time, right? And that's going to bring us to the next couple myths here. Two, well, nobody works for free, so the insurance company must charge a higher price if I go through a broker. Also false. The reality is the price is the same through me as it is to any one of my agents, as it is to anyone else who's doing a Medicare webinar, any other broker, or if you go direct to the insurance company. Okay, if we're comparing the same plan from the same company, the price is what it is. This is a fixed, price commodity. So I can't get you a deal. Neither can Joe Schmo down the street, and neither does going to the insurance company. So the way we see it is that you can get a no-cost resource, and it doesn't have to be through us. We're not the right fit for everybody. And if that's the case, then we are glad you're here today, and we wish you well, but we hope that you'll find another broker who can serve you the right way that meets your needs, because there's no reason not to take advantage of that free resource. So anyway, you're going to pay the same price no matter how you go forward with this. And then myth number 3, if you get paid by the insurance companies, you must have a bias. I could care less about which insurance company you choose. Yes, we do business with them. No, we don't work for them. They all pay us pretty much the same thing, and in some cases they have to all pay the same thing for certain products. So I want you to be happy, because for us to be a sustainable and profitable business, we have to keep you as a client, not just transact with you and move on. So our goal is to make this a lifelong journey. As long as you're alive and you're on Medicare, we want to meet those needs. We have access to over 25 different insurance companies for different types of products. So it's all about meeting your needs. We work for you, not for them. All right, so these 3 truths we cover: no fees, price is the price, and no bias. So prescription drug coverage, excuse me, I'm getting a little thirsty. So again, we have original Medicare, a supplement. This is if you're going Medicare supplement route. And then we have Part D. So this will be a standalone policy. It could be from a totally different company as your supplement. And it's going to offer your prescription coverage. Take that to the pharmacy. These are, you're not going to get this through the government. It's not included on the supplement plan. It's a separate policy that we would help you get based on your prescription needs. Now, just like with Part B, there's a late enrollment penalty for Part D. I don't want you to panic and assume that this is impacting you today. You might be able to delay because you have creditable coverage. But the way that works is 1% penalty for every month you could have had coverage but did not elect to enroll. Turn 65 and you don't have a creditable group plan and you go a year, that's 12 months, that's 12%. And that's of the national premium average. So if the national premium average is somewhere around $35 a month, now you're paying 12% on top of whatever the premium is for your drug plan. Okay, and that's a monthly penalty for life. Right? And so as the average rises, the percentage is going to be, represent a larger amount, and you're not going to stop paying those penalties until you disenroll from Part D, which is probably not advisable. Now, our process, okay, I'm not going to spend a lot of time on this. It's boring, but it's very important, and we do it with every single client. So input your drug list, specific name, dosage, quantity, frequency, into Medicare's online calculator. Okay, this is something Medicare has put out, not something that we've put together ourselves. We choose your pharmacy. You could have a standard pharmacy or preferred pharmacy. So we want to make sure we're taking that into consideration. We'll compare all the drug plans in your area. It might be 15, 20, whatever it is. We're going to look at all of them based on the drugs in the pharmacy and enroll you in the plan of your choice. So just like the Medicare supplement, just like all the umbrella coverage, right? We're going to help you with that enrollment. Okay, get the application done. And most importantly, which you should take advantage of with whoever your broker is reevaluate every year. October 15th till December 7th is annual election every year, and you can change your drug plan. Make sure you take advantage of that, whether it's through us or you go direct, or not direct, but you go to another broker, and the insurance company is not going to do this for you, but another broker hopefully will. That's an important opportunity for you to take every year, just to take a few minutes and confirm that you've got the right coverage. So again, just to recap, $185 a month over here on the Medicare Part B, 0 for A, between $100 and $200 a month for your supplement. And then for Part D, as I mentioned, the national average is roughly $35 a month, but you could be in the single digits for premiums, you could be in the triple digits for premiums, and that does not include, what you're paying out of pocket for copays. But just as you're writing things down, again, you can write 185, 1 to 200, and 35. And that's going to cover, again, your core Medicare product that you need to have in place. So option 2, Medicare Advantage. This is the other fork in the road, right? Or the other road, I guess, the other part of the fork, if you will. Now, Medicare Advantage, Part C combines your coverage. Remember that, right? This is managed care. I bet that's what you have today if you're watching this with an employer plan, right? Or unless you don't have insurance, you've got some kind of managed care plan. You have to have A and B, and they must include A and B services. So whatever the government is providing through Medicare A and B, the Medicare Advantage company has to provide it, okay? And most plans, many of them will include your drug coverage. So unless you're in a situation where you have some other creditable drug coverage through another means, like a VA benefits or TRICARE, or something else, you're typically going to choose a plan that has drug coverage, okay? But there are some that don't. Now, plans can be as low as $0 per month. And I just want to stop here for a second. How the heck is that possible, right? In the advertising that you see, especially in the fall, Joe Namath, all these people, they're pushing these plans on you. And I can't stand the advertising and the way that these companies try to sell people. But the reality is there are $0 plans, many of them. And that's Medicare Advantage. This is what you see advertised. The way that's possible is the government's paying the insurance company. And they're paying them in excess of probably $1,000 plus a month to manage your care, okay? And so they don't have to charge you a premium. So they're getting theirs. They're able to pass along the coverage to you. And again, it's great that they can provide this coverage. I just want you to understand why it's zero. They're not just giving it away. They are getting paid, so that subsidizes what they have to provide to you, which is maybe $0. You have to keep paying the Part B premium, though. You're not getting out of that. I think I mentioned that earlier, so just make sure you keep paying that. You don't lose Part B. And then for your coverage, you'll have co-pays, potentially deductibles, co-insurance. For each different service, you get a kind of a menu of services, co-pay for this, co-insurance for that. And there is a max out-of-pocket built in. Right now, Medicare allows for in-network care up to $9,350 per year per person. If it's a PPO with out-of-network usage, maybe up to $14,000, right? So the exposure is pretty serious, especially if you have care you're receiving from one calendar year to the next and it resets in January. Now you're talking about doubling your exposure, okay? But there is a limit, right? There is a max for Medicare covered services that you will hit. And not all plans have that allowable Medicare amount, so they might choose to have a lower one. We always recommend umbrella coverage, again, no matter what you're doing, but especially on the Advantage plan, and there's a lot more exposure, including hospital protection, because you are going to pay a several $100 typically copay per day for a certain number of days, right? So we're always going to talk about those umbrella coverages, including hospital and Medicare Advantage. Now, when you're choosing this, zip code number one. Not just state by state, zip code. Okay, so counties and different zips, part of the states, different plan options. Then we take into consideration your doctors, your hospitals, and your medications. I would never talk about Medicare Advantage or suggest plans without knowing your doctors, preferred hospitals, and your medications. That's where the decision starts. And then it goes into these extra benefits: gym, dental, vision, over the counter, hearing, whatever it may be. So start here, and that's what we'll do with you. And then the extras is what we would focus on last. Now, how and when to sign up. If you're going on Medicare at age 65, going with Medicare Advantage, we're going to take care of that as soon as you get your Medicare number, so 60 to 90 days prior to it starting. Again, I just use my birth month because it's easy and consistent. I'm born in April. I get my Medicare card in January. I'm taking care of this in January or no later than February. Check it off the list, avoid mistakes, and make sure I have everything in place, cards in hand. And then during the annual election period every fall, from October 15th to December 7th, you will be able to change that plan. You can change from one Advantage plan to another, from Advantage back to original Medicare and into a Part D plan, or from original Medicare into Advantage. Every year you have the option to do that. So again, comparing these options. Over here, it's more of a fixed cost model, a little more flexibility on provider choice, peace of mind with lower out-of-pocket. And over here, we're going to have lower monthly fixed costs, more variability, and potentially higher out-of-pocket costs with a little bit more restriction on provider choice. Doesn't mean that you don't have good networks. It's just there's no network over here. So one more recap on the umbrella covers, and then we're about to wrap up, I promise. So just another two or 3 minutes, and then we'll have you out of here. Remember, if you haven't already, click that calendar to book your time. There's a couple bonus items that you're eligible for that we'll talk about at the very end, to make sure you take advantage of those. Anybody who has an appointment will get those 2 bonus items. So remember, when we're talking about this, we're going to provide you options for umbrella 1, 2, or 3. Okay, you're going to choose that Medicare plan. That's a supplement or an Advantage plan. So it's either Advantage with prescription coverage included or a supplement with the standalone drug plan, okay? And then based on your wants and your needs and meeting your goals, we're going to help you with cancer, heart, or stroke, dental, vision, hearing, or hospital protection, and then the recovery care for that skilled nursing, since we talk about how large of an exposure that truly is. So if you have any question with this, we're going to provide this to you as well when you schedule the appointment. Now, when you schedule that appointment, we will go ahead and on the appointment be able to provide you a Medicare roadmap, personalized Medicare roadmap, and Medicare cost summary for your specific situation. So those are the two bonus items that we'll take care of with each and every appointment with our team. So phases 1, 2, and 3. Step 1, you're here today, online content. You're going to get that book. If you didn't get it, email or text us. We'll send it over to you. Step 2, schedule that free consultation, and we will get you that personalized Medicare roadmap and cost summary, the bonus items that we have promised. Okay, so make sure you schedule that appointment, and we'll get that for you. And then, look, at the end of the day, this is a lifetime relationship, okay? Free lifetime billing and claims service. You have a question, we're going to get you an answer, or we're going to point you in the right direction. You move, we're going to move with you. You need an ID card, change of billing, change of plan, we're going to help you out with all that stuff. And most importantly, that free annual review during the fall to make sure you have what you need for the following calendar year. Take advantage of that. All right, you're always going to have a chance to talk to a licensed agent about that in the fall to make sure you have what you need for the following calendar year. So again, go ahead and click on that calendar now. Reclaim that book if you haven't gotten it yet. And we look forward to seeing you soon. Thank you again. Thank you again for joining us today. And congratulations on taking this important step on your Medicare journey. We look forward to talking to a lot of you very soon.